All right, our broadcast was cut off just before, but we're back now with you. I'll reintroduce for those of you who are just joining us. It is December 29th, 2020, our final look at the COVID numbers across the state of Arizona for the year 2020. And we'll start where we always do, just in case anybody missed it. Garrett, we'll start right there on the summary page with the numbers coming out of the state of Arizona, especially put into context with some of the high case numbers we saw yesterday and what this all means. You do a great job of explaining it. So we'll start right there on the summary page.
So as we were saying, first of all, we didn't mention this yesterday, but we did reach the milestone of over 500,000 Arizonans have been infected with COVID-19 at some point in the pandemic. And of course, as we talk about these numbers, we always have to make sure that people know that it's not that 500,000 Arizonans are walking around right now with COVID. That is not the case. It's closer to anywhere from 60,000 to 150,000, but about 500,000 people have been infected. So today's numbers, 2,800 cases were reported today. When we look at what the epi curve looks like today, and I'll go that very briefly in a moment, we can see that they're doing a lot of maintenance, data maintenance to the MedSys system right now, and there were a lot of changes, a lot of small cleanups and additions and subtractions on 20 weeks ago in some cases. And then the other thing that we have to notate, of course, is 171 deaths. This is, and unfortunately, the deaths are much more recent. And this is the second highest reporting day that we've had in Arizona so far.
So when we see these numbers come in, and you touched on that high number of cases overall, and we'll explain a little bit more about what that means as far as who has active cases a little bit later in this broadcast. The other milestone number that was just passed as you talk of the death rates was passing more than 5,000 lives lost here in Maricopa County alone. So while we look at 8,640 deaths across the state of Arizona, we've lost more than 5,000 just in this concentrated county of Maricopa County. So we'll have more on that throughout this hour. And Garrett, on this page, this summary page that we showed, you can click through to see your particular county. If there are people watching who want to know a little bit more about one of the Arizona counties of interest to them, simply click on that and you'll be able to those by how are our hospitalization numbers looking right now? That has been one of the biggest concerns that we've talked about over this holiday and throughout this month, and one of the areas of highest concern.
So the hospitalizations, we are seeing increased COVID-19 hospitalizations. We hit records in several factors today, several metrics. We hit a record for ICU. We hit a record for inpatients, and we hit a record for ventilators. We see something going on right now that's very important to notice on the census. This is the census bed count. It's done self-reported by the hospitals every day. You can see that, again, the hospitals are struggling to keep the census at about 90%, 91%. You can see there was a lot more people that were not admitted to the hospitals that did not have COVID-19 as they try to maintain this bed count so that we don't get into a situation which we saw, say, in California, where they were at 0% ICU in some places in California. We're trying, the hospital systems here are trying to keep this at about a 10% headroom. And we're seeing this all over the place here. Adult ICU beds, 1,053, the highest number we've had so far. When we go to inpatient for COVID-19, 4,475, the highest number. It was actually quite a large jump over the weekend. But again, you can see they're struggling to keep that number down. They're trying to keep the hospitals at about 10% free. We also had a jump in emergency room department beds. Now, from the medical doctors that I've talked to about why this could be a jump here, is that there's simply, now this number what this number is this is literally a bed count of the emergency room departments in Arizona at about 5 p.m. So what this could be, seeing this increase, is people in the emergency room waiting for an inpatient bed that have COVID-19 or not COVID-19, but they're basically using it as a triage in some cases. And that's why this number is spiking right now for the past 2 days, as they're sort of trying to keep this bed management going on. And then just to go over the other hospitalization numbers, we'll go over the ventilators. Again, as I said, a record number, 720 today. About 70% of people in the ICU that have COVID-19 also are on a ventilator. The discharge number is up a little bit to 794. Emergency room for COVID specifically, 2,117. This is the second highest it's ever been. And then the intubations is up a little bit at 121.
Okay, so we also have heard of Six Valley hospitals that are starting to divert some of the patients, and you can find that reporting on abc15.com as well. That you can find all of our coronavirus reporting right there. It's abc15.com/coronavirus if you want to know a little bit more about, how they're having to manage all these numbers and keep that headroom that Garrett talked about there. Garrett, the other important number that we've been tracking so closely, and it's a newer number and it's definitely a more hopeful number, that's the number of vaccinations that we've seen here in Arizona. I saw before the holidays that the number was really getting going, and I know that it's people are working over the holidays or have other plans over the holidays, and the vaccine is not on the top of their list, but the day after they're right back out there. So how many vaccinations do we have so far that have taken place in the state of Arizona?
We have about 40,000 vaccines that have been administered so far. Now, a couple caveats on that number. We only have really reliable reporting right now from Maricopa County and Pima County. And even Pima County is only giving us estimates. Like they're giving us rounded estimates. I think today's was 9,000 or 9,500. Maricopa County is the only one that's giving us the actual number of what's in their system, and that comes to about 40,000 altogether. We did add about 7,800 vaccines yesterday. From day over day reporting.
Right.
Now,
right.
When we look at Maricopa County, Maricopa is about, I think it's 24,000. Let me just check really quick. I know we're doing some reporting on this right now based on these vaccine numbers because it seems that, this 1A group, 29,000 vaccines were distributed in Maricopa County today. That's today's report. Not today, excuse me, 30,000 over time.
Right.
Now, that first 1A group, most of the hospital workers, it's about 125,000 people. So we're still at only about a quarter of the 1A group has been vaccinated. What we don't know yet is this a situation in which these people are not going to get vaccinated, or is the rollout being done incorrectly or slowly, and that's why they haven't really finished up this 1A group yet?
Right. So they, as soon as we hear anything more about, what is the holdup in that, we'll of course pass it along. What we are learning today about all of that is that Arizona residents who are 75 or older, they're the next in line. They're the next group to make their way through and be able to get their vaccination. So there was a committee that was comprised of local and state and tribal officials who came together on Monday. And they said that the Arizona residents who are 75 and older are the ones who are next to get that vaccine. So getting you specifics on how that happens, how you get signed up, we'll provide all that information outside of this broadcast. But it's been one of the top priorities since the start of the pandemic is to protect that group, because we know how vulnerable they are. It's something that's been echoed by the governor to prioritize this group, to make sure that they're vaccinated sooner, that we're protecting this group, especially because of the outcomes that we've seen and the number of deaths that we've seen in that group. To be totally honest, I mean, this is a group that's seen a disproportionate number of deaths after suffering from COVID.
Yeah, this group is definitely impacted more than any. If you look at Maricopa County's numbers, for example, when we look at those numbers, we can see about 84% of the deaths that have happened in the county from in Maricopa are either from someone who is 65 or older or have at least one comorbidity. So this is the most, the highest risk group by far. Now, I see Terry is saying, I thought it was 65 and older, not 75. So Terry, what that is 65 and older is the reporting number that they're giving us. They have the actual 75 plus. And we do know, just based off of CDC numbers, that 65 plus is a bit of a misnomer, because most of the deaths, even in that range, are occurring on the higher end of that range. They're coming in of people that are over 75. That 65 plus number is not as high. So what that means essentially is that they're saying, look, we're only going to give you the 65 plus to basically protect this group's privacy. But at the same time, we know, because we have this data, and I'm talking as at the AZHS has this data, we know that it's the 75 plus that are definitely the highest risk.
Yeah. So specifically what they were saying in that is 75 and older are 8 times more likely to be hospitalized, 220 times more likely to die compared to younger adults. And then for individuals 85 and older, obviously those risks increase even more.
Oh, it's like 1,200 times. It's not even. crazy. Yes. Yeah.
Wild numbers. And of course, more often living in a congregate care setting, which we have seen time and again that it can spread so fast. So making sure that these groups get vaccinated right away is of high priority. Obviously, the healthcare workers, the emergency medical services workers went first, and now the residents and staff at the long-term care facility. So we're working our way down the list, but it's taking a long time. The state officials are saying that this group, referred to as prioritized phase 1B, could likely start receiving their vaccines by mid to late January through the state. So kind of getting a little more of a framework and a timeline of when all this would happen. We know it is of high interest to everybody. We'll continue reporting on it as we learn more information and more specifics on how this is going to roll out, how you're going to be contacted, how you can sign up, how you get bumped higher on the list if you have other health issues that would deem it necessary for you to get the shot a little sooner. We'll continue reporting on all that and pushing for the details as we get closer to that point. What we do know is across the country, 2.1 million Americans have been vaccinated. So a decent number so far. I don't have the number of how many have gone out across the country. There have been some issues about the distribution and getting those things administered. There was a place in Wisconsin who had to throw a bunch out because they were left out. So of course, you know, no rollout is perfect, but there are issues across the country. So we'll keep you updated on that as well. Back to the numbers outside of the vaccination numbers, and we want to get to some of the questions as well, Garrett. But the testing numbers, are we still seeing people testing as much as we were before Christmas? So a lot of people were rushing out to, they were hoping to sort of test out and be safe enough to get together with family. Obviously, that can be a false protection, if you will. It's a bit of information about that particular day that you tested, but of course you can be exposed before you go see loved ones in the time that you've left the testing site and gone anywhere else. But are those testing numbers still as high as we saw before Christmas?
No, we're actually seeing a decrease in the testing, the 7-day averages in the testing as well. Right now, our high of 7-day average for the testing was over 20,000, and that was about 2 or 3 weeks ago. And now we're looking at about 16,000 tests on any given day. It has gone down. It's not even in the top 10 anymore of reported numbers of tests coming out. And actually, that's the case with everything except for deaths. Our cases and our tests are no longer are no longer breaking the top 10 right now. And again, we see this in our testing numbers. They are going down. Let me show you what they look like. I'll look at the epi curve today. And here we go. And again, a lot of this could have to do with holiday reporting. We could still be looking at sort of a, just a slowdown of the reporting. As you can see, not a lot of light blue. If anyone who's been following us for a long time, they know that the light blue means it was added today. The dark blue was added previously. You can see a very few were added today. Most being added, or most of the, like, this is usually a much bigger curve. You can see it dropping significantly, but this is, you can see at the top of the epi curve, we were here at 30,000, and now we're sort of in this 20,000 range, which is our top numbers. This isn't, again, a reported. This is our daily collected numbers, and that's why it's a little different. Here's what this looks like. On this case, you can see about 10,000 of the tests that were added for the week of Christmas, and only about 3,000 tests were added for the last couple days.
So, Garrett, when people are going out getting tested, it's still around time of about 36 hours at most places. Is that what we're still seeing?
Yes, I am still seeing a lag of about 3 to 4 days on the testing right now. It doesn't seem to be any higher than that. So testing is, I know that there was an issue with Embry Women's Health for a while, and that may have been, I haven't heard anything of that being an issue still. It does seem that in fact, we had a situation yesterday, if you remember, well, you weren't here. Our positivity rate, the simple positivity rate, which is the simple reported tests or cases positives divided by the total test, was 140%. And the reason it was 140% was because tests are coming in faster than they can research cases. So because of that, we are seeing tests coming in, negative tests are coming in at a much faster rate now, and then it's taking a little bit longer for them to get the cases through.
Okay, so what's a more accurate number then for the percent
About
positive?
20%.
20%? Still high.
20%.
I mean, one in
Yeah,
five.
it is high right now. Yes, it is. Yes, yeah, it's very high right
Wow.
now.
Okay,
So,
so go ahead.
oh no, I saw someone saying the 99.98% survival rate. They're making a comment about vaccines on there, and I'm a little bothered by that right now because what we were just talking about, Katie, about the older generation being much more susceptible to this.
Mhm.
And the reality is, when you use that statistic, when you use that 99.9% recovery rate, also just make sure you understand that you are also saying that you are okay with 6% of a population over 75 dying, because that's what that recovery rate statistic actually also says, because it's about 94% of that age group. So just when you guys when you want to use that statistic, understand what that means, instead of just saying, oh, it's 99.9% of the population. It is absolutely not. It's 99.9 for young population. Yes, for older population, it's significantly lower.
Yeah,
So
and as so many people have said, go choose who in your life is not going to survive this. I mean, when it becomes a personal thing that you're experiencing, instead of just talking about somebody out there obscure to you, it becomes a totally different story. So
yeah,
that's the thing that's concerning.
I,
And there's so often so many ableist comments, and
yeah.
and ageism creeps in, and yeah, the patience
And
I have
I've also
becomes.
seen a couple of people asking for recoveries. So hey, let's give them those numbers, right?
Let's do that.
Because
Okay, so when we talk recovery, defining that is a little bit difficult. I'll
yes,
let you launch into that a little bit more, because everyone's definition of recovery is different. I have friends who have quote unquote recovered because they got a negative test, but they go back to work and they're winded constantly. They're not physically the same person they were before they got COVID.
yeah,
So
it's one of those things that the reason we don't call this recovery, we call it active versus inactive cases, because there's no set definition of what a recovery is. Some people, some age groups will have this for 2 to 3 days and won't have anything. And then some people, even in the healthier age, or the typically healthier age groups, they will have symptoms carry over for months. Even if they're no longer infectious, they'll still have problems with some of the symptoms. They won't be able to taste or smell, or they'll have breathing problems, something like that. So what we do is, in order to get around the fact that we're not getting recovery numbers from the state, we are giving what's called the active inactive number. And what we do with that, as we talk about this all the time, it's cases that are under 14 days from the positive test, and then cases that are under 27 days. And what we're looking at, that is about 66,000 cases under 14 days, and about 153,000 cases that are under 27 days. So what that means, 66,000 to 153,000 cases, that's where our active infectious is. Aside from that, that means that there's about 350,000 people in Arizona that have had the disease but are no longer infectious.
Yeah, it helps us better understand that 500,000 number. I'm so glad Sabrina's comment is punched up right there, because it was one I wanted to highlight next. Sabrina's writing that she has lost 3 family members because of this. So thank you guys for being so passionate on this topic. And Sabrina, I cannot express to you enough, first of all, how sorry I am that you've lost 3 family members, and the disproportionate loss that you have experienced through all of this. I mean, this is exactly why we do this. I told Garrett yesterday, my passion is renewed when I talk to a friend who's just lost their parent. And that was my experience over the weekend, talking to one of my girlfriends who lost her mom to this. And it absolutely renews my passion to continue to help people understand these numbers, because when someone has disproportionately experienced this, it is so absolutely unfair. And we think of 336,000 Americans who've now lost their lives to this, and 8,000 Arizonans. Just incredible. Seeing Christy's comment there, our school lost a teacher. That's so sad too, because explaining this to your kids, you want them to feel safe and secure and understand what's going on, but then they see a loss of a teacher, and it's so sad.
Yeah, and there is, I see a couple comments also about flu and dying from the flu and dying from a heart attack, and there's the other thing that we talk about all the time, with people presume that there's quote unquote death laundering, where there are deaths that are occurring because they could have no COVID-19 symptoms, but because they died from a heart attack, they would be labeled COVID-19, and that's just a misunderstanding of a death certificate. If you have the flu and you get pneumonia and you die from pneumonia, your death certificate will also say that you had the flu, just like it would say if you had COVID-19 as well. It does work that way. Death certificates don't have one line for cause of death. They have multiple lines. So if you have the flu, heart attack, and then you die from it, then you're going to be marked that way, just like you would COVID-19. The only difference as far as what this report, what we're looking at, is that we're seeing these numbers on a daily basis. The flu reports come out on a weekly basis, but they also come out annually, really, in many cases. And COVID-19 will be a part of that annual report when it comes out, but it hasn't come out yet. It takes a full year to have these things, and realistically, it's going to take probably another year for COVID-19 simply because it's still ongoing.
Yeah, if not 2 years. So we're seeing some of those final reports for 2018. And I'm glad producer Carrie just put up the link for where you can find out more information on the flu numbers in Arizona. The link was just up there on the screen. If anybody wants to check that out, it is a separate section of numbers, and you can find that on there. And the push to have so many people get a flu shot, to continue to provide and wear masks throughout parts of Arizona has helped keep those flu numbers much lower, which is the good news. And honestly, Garrett, when now at this point, at the end of 2020, when I'm still seeing people name this the flu or call this the flu, at this point, I'm like, I don't even care if I convince you to call it something else. Call it what you want. We have 336,000 people dead. At this point, if you're going to wear your mask and distance and you want to call it something else, I don't care. Call it something else. Just help save lives. It's at this point, I mean, I guess I get a little frustrated because I'm done with the whatever you want to call it. You know what I mean? I'm done with that. Like I just have zero room for it anymore.
Yeah, it's tough. I mean, there's a lot of stuff that goes around about the reporting on COVID-19, and it can be frustrating sometimes. We're constantly accused of being fear mongers, and I don't know what to tell you. We're showing you the data when we've done these same reports on a daily basis when things were looking good, and just things aren't looking good right now. So I mean, when things start looking good again, these reports, these daily broadcasts we do, are going to look better. Because we'll be talking about things, numbers declining, but that's, this is just the way it is right now.
Okay, so when we saw that, and I know you guys talked yesterday, when we saw that large number of cases, 10,000 cases coming in yesterday, and obviously that has to do with some of the slow reporting and the late reporting coming from the holiday, coming from the weekend, coming from all those factors. At the end of the day, though, when you're totaling up the whole week, you're pulling out any anomalies for holiday reporting or weekend reporting or whatever, you still have a massive number. And we're still seeing about 8% of those then showing up in Arizona hospitals. So if you have a day and you have 10,000 cases, or you have a week that's totaling, I don't even know what we're totaling for a week. What?
About 46,000 cases or so right now for a week.
46,000 cases, and then 8% of those showing up at the hospital.
You're going to show up in the hospital about 7 days later. Yes.
Yeah, ending up in the ICU. We're still going to be flooded with people needing care.
Yes, and this is why I'm just showing you what that case curve looks like. Our top week was December 13th at 46,000. Right now we're at about 29,000 for the week of December 20th, but we're still going to have numbers being added into that for the next couple days. So I don't think this is going to get to 46,000. It's probably going to end up somewhere at around 35,000. It does appear right now, which means we will be seeing a week-over-week case decline. But as you said, Katie, we still look at these numbers, and we still have when you see this number, 30,000, for example, just if we take it right now, and that's only to December 20th, which was about 9 days ago. So as you said, we're at a situation in which 8% of this week, they're going to start showing up in the hospital, because how this disease progresses is it's usually, the onset of symptoms, testing, all of that takes about 4 days. And then if the disease is bad enough, it's going to take another 5 to 7 days for you to actually go to the hospital. So we're sort of in this window right now where this group is going to start going into the hospital as well.
Yeah. Okay. So Garrett, this is our last update that we're able to give for this year, and then we'll be back with everybody next week, which will be launching into 2021 already. how are some of the forecasting look? What do the numbers look like? What can we expect here in Arizona for January to look like as we look at these numbers and start to analyze these numbers right now? How do things look?
Sure. We're going to go to the University of Washington's forecasting site. It's the best one to look at right now, and it does have sort of what the vaccine could do to the numbers. As you can
Hmm.
see, there's very little change right now in what they're going to think happens in Arizona based on the vaccine. Right now, in say January, it does think that obviously this is a cumulative total, so it's going to continue upwards. It believes that about mid-January we'll be at about 11,000 deaths, and then by April we're going to be at about 15,000 deaths. When we look at the daily death numbers, it does believe, and this is probably very accurate at this point, that we are not at the top of the numbers here. We're probably going to get all the way up here on about the middle of January. We're going to see a rise in the death counts until about the middle of January, and then it's going to start going down until it gets down to the low double digits in April. And then when we look at daily infections, let me take out these because they're policy issues. It does believe that our daily infections are going down. We hit a peak on Christmas, and we're going to start on a down curve. But the vaccine doesn't really take effect until March. And as far as hospitals, it does believe that we still have to wait until about the middle of January before our hospitals begin to go down as well.
Okay, so a couple different numbers you can check out in there. And as I remind everybody, this page has pull down menus for different states. So you can see maybe if you're
Yeah.
not from Arizona, how your home state looks as well across the country, but also numbers throughout the US. Are we seeing our curve match then the US curve, or are those not in line right now?
Yeah, we're actually, if you look at what the US curve looks like, and let me go to that really quick, you can see that we match the normalized US curve fairly
Mhm.
well right now on what's going on, where we had a peak of cases happen about 5 days ago, and we're starting to see decreases. We look at where we are, Arizona, we can see that's sort of what has happened about 5 or 6 days ago is when we were going up. We're going on a downturn right now. As you can see, our neighbor to the west, actually, this is one of the first times that California has higher case numbers than we do. In fact, California has the highest normalized population case numbers in the country right now, just above Tennessee, and then Arizona is next. So as you can see, on the West Coast right now, we're having some big issues with cases. But our numbers are pretty much matching what we're seeing in the U.S. right now.
Okay, it's interesting that you say California. They're starting to at least level off a little bit.
It doesn't. I don't know. It's hard to tell by where they are right now. You can see their numbers are bouncing up and down a lot. A couple days ago, 2 days ago, they were at 93, and then they increased to 98 per 100,000. So they're. I'm not sure if it's a leveling off quite yet, but it does look like they may have reached at least an initial peak right now. That doesn't appear that it's gonna, go back up. But again, we have to wait at least another week or so to see what those holiday numbers are going to do. So, we really don't know what those gatherings at Christmas, if they're going to impact the numbers. It's going to take at least another until like maybe next Wednesday. That's when we'll start to see them. And, we don't know what's going to happen at that point.
Yeah, it's like Claiborne Jones is writing on there. Looks like 2021 will get off to a bad start for maybe 6 months or more. Yeah, I
Yeah, it
mean,
might be 6 months. Might be. I don't think it's going to be as bad, Claiborne, in 6 months. I think our numbers probably are going to look very manageable in about April. But again, that has to do with where the vaccine rollout happens, how far they are into the distribution and administration of the vaccine in March could play a lot into if it takes 6 months or if it takes 5 months to get back to normal.
yeah. I had asked specifically about California because the governor came out this morning, sort of warning people who live there that this lockdown that they're experiencing could last a little bit longer. So he was wanting to sort of set the stage on expectations there on that. So worth watching those numbers. Debbie, who joins us on here, Austin writes, what is happening with the R naught number? Would that be a stable number right now, Garrett, with that
Yeah,
10?
I think it would be fairly stable right now. Let's see
Okay.
where we are. I'm looking at, sometimes it takes me a while to find it. Um, wow, I thought we're in the green today. That's interesting. I didn't realize we were in the green. This is the first day we've been in the green since early November or early December, excuse me. Yeah, early December. No, I'd say early November, right? At least our reported number. Here we are. We're about middle ground right here at 0.95. As far as the stability, Debbie, it's probably stable. Today's number probably isn't going to help very much, but the next couple of days will probably even it out. I think realistically, we're probably at this range, either 95 to maybe 1.02. We are seeing slight case increases right now, but they're very slight. So this one is trying to project what's happening in about 2 weeks, and it thinks that we're going down, and it could very well be right at this point.
Yeah. D. Thomas is asking, will schools open? And I know you got some really good insight when Danielle was filling in for me yesterday. She's our education reporter. And I want to remind everybody that you can find the very latest information on schools, either in your neighborhood or where your kids go or your grandkids go or any school you're curious about, on our abc15.com/schools. Once again, abc15.com/schools has all of our very latest reporting on the plans for school districts here. For those of you who don't have kids, usually they're going back into the classroom on Monday. So everybody watching that closely, and a lot of places saying we're going to give it a little bit more time and stay closed for a bit. What more did you learn from Danielle yesterday? I know she provided some great insight on that.
Yeah, I mean, we did some work on the GIS dashboard, looked at where things were and what was going on with the school districts, and I'll just show the dashboard really quick. All of Maricopa County at this moment is in the red. There is not one yellow transmission anywhere in the county right now, and that, of course, since this is the zip code level, which is the most granular level we have, obviously the rest of the school districts are also going to be in that situation. So Danielle sort of alluded to the fact that, as what you just said, Katie, we have most of the school districts are they're looking at these, they're using these numbers specifically and reevaluating where they should be, and it doesn't look like we're going to have openings, at least in the next couple of weeks, essentially.
Yeah, that's what it seems like. Where's that CLI showing up? What number are we getting for that right now? I know if you click on
the CLI is about 12.6 in Maricopa County. So, and let's look at that really quick statewide. I'll go over to the Arizona DHS dashboard.
As you're pulling that up, Garrett, I'll let you pull it up, and we can answer Jackie's question. Jackie's writing, worried about my son. One of his golf buddies tested positive. So, Jackie, the best advice at this point is, because there's room in the testing, you may as well have him run over and test through ASU. It's so non-invasive. It's the saliva test. So basically he would go into the portal, sign up in there, spit into a cup. Tomorrow morning, you can sign up for the next one. Let me think. Wednesday, I'm forgetting where Wednesday mornings is. It's not at the stadium. I'll have to think of where it is, but sign up on there for tomorrow morning, and you should probably get results back for your son the next night. I'm thinking usually around 10 p.m. they update the portal with the numbers in there. So if the turnaround time is still as fast as it's been, and there's no reason to think that it's not this week, you could have an answer, and just take that worry away, and then have
and also, but Jackie, just remember that with those antigen tests, they are not as sensitive as the PCR tests. So, for example, I would, and again, I'm not giving medical advice, but if I were to be in the situation that your son was in, I'd probably wait 3 to 4 days from that contact before I went in to get the test, because if I went in too early, even if I had the virus, there's a good chance that it wouldn't catch it because it's not as sensitive as the PCR test. But in many ways, that's a good thing, because you're not going to catch something that's not going to manifest, or that had already been there with an antigen test. But you also won't catch it if it's at the very beginning or the very end of the infection.
Yeah, really good advice and all that. Then you just have peace of mind. Then you don't have to worry as much. All right. You were going to show us the chart that you were pulling up.
Yeah. So CLI numbers right now for the week of 12/6, you can see, or at least at 12/20, you can see it's been fairly level for most of December. It's gone down a little bit for the inpatient numbers. It's at 20.1 right now from a high of 20.6. The emergency room department numbers, as you can see, much noisier for the last week. But the 12/20 is at 11.7, but realistically, the 12/13 is probably the best one. That's at 14.8 right now, and that's where it seems things are. As you can see, this sort of matches what we're talking about with hospitalizations, in which we're seeing peaks, but we're also seeing we're not seeing sort of this exponential increase any longer in these numbers.
Yeah. Okay, and those numbers are updated, just to remind everybody, on Sunday, and then the statewide map that Garrett showed before this, that'll be updated tomorrow. So we won't be here with you, but if you're interested in checking out those numbers.
And at this point, when you check it out on Thursday, if there's even one yellow zip code, then someone's getting better. Now, what we did when we were looking at the dashboard, Katie, I'll just go over there with you again. We did see that sort of the infections on the zip codes have sort of shifted back to the southwestern portion of Phoenix. Things are starting to get a little better in the suburbs, and we're starting to see sort of the core downtown portions of Phoenix are rising. So this is what happened in the initial pandemic back in the summer. Those initial rises were really drawn in by the core of the city, and the suburbs were not touched that much. And while the suburbs this time obviously are still in the red, they're starting to see sort of a leveling off or decreasing of cases at this point.
In the Southeast Valley, or just in the suburbs?
In the Southeast Valley, almost all. In fact, most of the suburbs, all the way around the ring of Maricopa County. Most of them from Peoria, Scottsdale, all the way down to the Southeast Valley. Most of those they had slightly decreasing infection rates per week, whereas the ones in the middle, the zip codes in the middle, from Glendale down to Levine and Southwest Phoenix, those were all had increasing zip code, increasing COVID-19 cases.
Yeah, because I remember that area. I believe it was south of the US 60 and east of, what was
Gilbert.
Gilbert was red hot at that point.
It was red hot, and it's starting to cool down now a little bit. Like we're seeing sort of it's decreasing from. I'll give you one example. I'm, like I said, not going to go over the zip codes today, but for example, if I go to one in. I'm just trying to pick one here. Here's 85233 in Gilbert, from 606 last week to 544 this week. So still very hot, but definitely like and sometimes it's just like Mesa 85212 going from 687 to 684. So what you're seeing is either leveling off or a slight decrease in cases per capita in the suburbs. And then if you go to like 85302, which is in Glendale, you're going from, or it's not that one, sorry. From like, I'm trying to find a good example here in the Southeast Valley. Here's one. Okay, so yeah, I can't do this on the fly right now. I'm sorry.
That's okay. We understand. But an interesting shift in the map that we're seeing. And the changes in the suburbs. I'm seeing some questions in the comments about what the tests are costing, and these coronavirus tests should be free. Now, I know people are paying for them if they're doing like a rapid 15 minutes, something special, but these regular tests that you're going to get, that you're getting like 36 hours later or whatever, those should be coming to you free, both the saliva and the regular nasal test that you've seen so much of. To sign up for any of those, you can go to the Department of Health site. And right on the front page there, where it's got all the COVID information, about halfway down is where you can set up that portal, either for ASU, doing the saliva test, or doing the nasal test. So AZDHS is where you can find that. Speaking of finding things, I want to teach everybody, Garrett, where to find the information on vaccination numbers. Is that something that is being publicly released on a website, or that we're requesting specifically through the newsroom?
So there's two places right now to find the vaccine numbers that are the most reliable, and they're on the Maricopa County COVID-19 site, which I believe producer Carrie has sort of ready to go in the numbers there. But here, if you look at this here, you can, right here it says COVID-19 vaccine. You can click on this, and then right here you have the numbers, and this is updated pretty much every weekday. As you can see, 30,000 today, essentially 29,586, with 5 distribution points open, and volunteer hours about 1,384. So that's the first place you can go. The second place you can go is actually the Pima County dashboard. And this one, at this point, I would say hold on, let me get to it. I don't actually have this one linked right now.
So,
One.
while you're pulling that up, Garrett, I want to remind everybody on that page that he just showed through Maricopa County and how it's got that display up there. It does display where we are in the group numbers. So just like boarding a Southwest flight, if you will, you can find out what group number you are in by answering a few questions about your age and where you're living. If you're in a care setting or a facility with several people, or just in a typical home situation, you fill in that information, you fill in the county, and it gives you your group number. So it gives you a good idea of where you stand. And then at the top of that page, it's showing you what group we're in. So you can sort of anticipate how far out we are. Although it does not give you a set date, it doesn't say, April 13th is the date you're going to get the test. What it does do is let you know when you're getting closer and you start needing to pay attention a little bit more about when you can go get your shot. So that's helpful in there.
And this is Pima's site. This one, they said they only give us an estimate. They say we administered around 9,370 through December 27th. And this is the way that seems that their numbers are coming in. They're doing a rounded estimate. And you can find this on, if you just Google Pima County COVID vaccine, this will come up as the site. It's one of those really long URLs that, I can have post to the comments, but there's no way someone will be able to. You have to copy this down. It's pretty crazy. But this is the place you can get it in Pima County. And those are the two places that are the best places to get what the vaccine updates are. The other counties don't really have anything yet. Most of them are Moderna vaccines, and they're just getting them right now.
Yeah, that's one of the things we had reported on, that Pima County and Maricopa County were going first, and then the other counties across the state are going to be receiving theirs. All right, okay, we are, and I see that long address there. Thank you, Producer Carrie, for putting that up for anyone interested. As Garrett mentioned, it's a little more complicated, so whatever works the best for you to find it. But I wanted people to be able to get information on how the vaccine was moving along. I find it to be a very hopeful number, and that you can look into it a little bit more. Monica saying, please repeat that info about the individual's group number is coming up. Oh, Monica, what I was saying is I'm assuming you're in Maricopa County. If not, let us know. And like I said, the other counties hopefully will follow suit. They are letting you know on that site sort of where they are in the group. So you can fill in your information about age, where you live, and just sort of, it's like 5 questions that you go through. It does not give you a specific date, but it'll give you your group number. So if you're in group 1A or 1B or 1C or 2, or it tells you that, and then you can sort of see where they are in making their way. So it doesn't give you a date, but it does tell you like, oh, we're through this group or we're starting the next group. So it's helpful, I think. Let's see. So that information we went over, Garrett, I want to let everyone know where to find us. We have some changes in our schedules over the next week into the new year, but we'll be back with everybody in the new year, keeping everybody updated. What can they expect from your Twitter account while we're away?
I am going on vacation. I'm going to try to update the daily reported numbers, but I'm not really sure how well that's going to work out. I will do my best to update them, but if I don't update them, if I do not update the numbers, I will almost always either retweet one of my acquaintances on Twitter that also updates the numbers, or the AZDHS numbers to actually just show what's going on. Yeah.
So, and as we have taught you guys, I know you have learned this throughout the past 6, 7, 8 months. I don't even know how long we've been doing this now. The information can be found on AZDHS on the summary page, and you can click through your county and you can learn a little bit more about cases, sadly the death numbers, but you can see some of the increases, and so many of you have been with us for months and months that you all know where to find that. Everybody's saying, enjoy your vacation, Garrett. Enjoy your vacay. You deserve it. Cindy's writing, good for you. Well deserved. That's for sure. Kristen's writing, thanks you guys for doing this. Happy New Year to both of you. And same to you. Thank you to all of you who've joined us throughout this year. I cannot believe this whole year has gone by that we've been reporting on this each afternoon. So hopefully you've learned something here, and you're able to find a lot of this information for yourself as well. We'll be back with you next week. In the meantime, all of our coronavirus related reporting can be found on abc15.com/coronavirus. It's all right there. Our newscasts are coming up, of course, this afternoon at 4, 5, 6, 6:30. 9 and 10 p.m. So you can get the very latest info there as well. the Twitter account that we just talked about that Garrett tweets from. So popular. Garrett, you have more followers on Twitter than I do now. Yes, I'm proud of you.
I don't know what the definition of popularity is. I kind of get beat up now.
Oh, yeah. I'll leave it at that. Garrett's Twitter account is at Garrett_Archer. That's where you can find him. My Twitter account is at Katie Rammel. And let's see, if Facebook is your preferred method, you can find me on Facebook at facebook.com/news from Katie. Jackie's writing, thank you both for everything you do. You're so welcome. That is why we want to join you each day to help you better understand the numbers so that you can make the best decisions for your life and your family. All right, be safe out there, everybody. Garrett, enjoy your vacation. We will see you in 2021.